The nation that was created and nurtured on a diet of porridge and herring is now one where pie and chips rule, okay. For thousands, trapped in a cycle of bad diet, boredom and nicotine, Scotland has become a nation of heart attacks, just waiting to happen.
Within a 200-yard radius of my surgery, there are 5 fish and chip shops, one of which is open at breakfast time for the night shift coming off. All are open at lunchtime for the school children, and I'm sure this must contribute greatly to the incidence of vascular disease. I became very concerned about the incidence of cardiovascular disease and the premature deaths when I saw the effect on young families of the death of the breadwinner. And I felt that this was one area in which prevention should certainly be practiced.
A new health initiative is set to wage war on heart disease, Scotland's biggest killer. The SHARP organisation, linking medical experts and lay people, says a quarter of all coronary deaths can probably be prevented. The new group launched their campaign today at Gleneagles Hotel.
This new initiative aims to spread the gospel of good living throughout Scotland, marshalling the support of medical specialists and GPs to impress upon people the vital importance of keeping their arteries in good shape. Propaganda will be the main weapon in getting people to keep their cholesterol count and blood pressure at normal levels, and most importantly, to abstain from smoking. But SHARP will also encourage regular screening for vascular illness at GP level, particularly for the middle-aged, half of whom in Scotland die of heart disease. One of the campaign leaders, Professor James Shepherd of Glasgow, spelt out the message.
Well, heart disease, of course, is a major problem in the community, and the only way to identify individuals who are at risk of having a heart attack is to look for a number of lifestyle factors which influence the way they live, and these lifestyle factors can be checked in a variety of ways using very simple techniques. A nurse, a little bit of information from the patient, measurement of cholesterol level in blood, and a measurement of blood pressure.
Health Minister Michael Forsyth launched the privately funded facility in Dundee today. The converted double-decker bus will tour the country, screening and advising people in a bid to knock us off the top of the world's coronary disease table.
Scots Health Minister Michael Forsyth officially launched Scotland's first mobile screening unit, the government's only contribution to the facility. Every penny of the £100,000 total cost has come from private coffers. But following an on-the-spot health check, the Minister was eager to stress the government's commitment to reducing Scotland's acute heart disease figures is not in need of major surgery.
It's absolutely essential, and we've set a target to reduce the number of premature deaths in Scotland through coronary heart disease by a quarter by the end of the century. Now that's no less than saving 10,000 premature deaths. We've an appalling record on coronary heart disease. Much of it is preventable. And we're prepared to put in the resources through health education and indeed through screening and other approaches to try and get that record down.
Death rates from heart disease in Scotland are among the highest in the world. Adult men living in the East End of Glasgow have an 80% higher risk of dying from heart disease than men in the rest of Scotland. The Glasgow project was conceived as a promising way to achieve this aim and as a prototype for further localized health education exercises. Built in the heart of the East End of Glasgow, the Forge Shopping Centre was an ideal choice of venue for a roadshow-style exhibition, which would pull together a group of appropriate professionals with the ability to provide on-the-spot cardiovascular disease risk screening and individually tailored advice. A high-profile, professionally designed display was built in the centre of the Forge to house the event, which was manned Tuesday to Saturday, 10 till 4. This proved very successful, not only in attracting the high-risk target group, but also the mothers of the household as they visited the shopping centre.
Hello, Today we're discussing the effectiveness of the primary healthcare team and how much you can do as GPs in persuading patients to improve their lifestyles. It's suggested that brief interventions can effect change in some patients, at least in the short term. If that improvement can be sustained, then the cumulative effect should be a higher proportion of the population with a healthier lifestyle.
You know, you could ask anyone in the street and they'll tell you that they eat fairly sensibly. But the figures for premature heart disease tell us a different story. Regularly eating food which is high in fat seriously increases the risk of heart problems. So, if you want to cut the risk of dying young from heart disease, you need a healthy diet. And what this means is reducing the fat, eating a wee bit more fruit, vegetables, bread and cereals, and keeping salt and sugar down. And if you eat well, you'll look and you'll feel well too. Over the next few minutes, we'll find out just how easy it is to get the balance right with a few simple changes to what we eat and how we cook. So, let's take a look at a day in the life of healthy eating.
Every year, 50% of Scots who've had a myocardial infarction survive. But what about the 50% who don't? Can anything be done to identify those most at risk prior to a heart attack? And can any measures be taken to reduce such risk?
Mobile to 49-year-old male, possible MI for 9 wells over.
Well, good morning and welcome, ladies and gentlemen, to the Royal College of General Practitioners for this press launch of our Heart Pack. I'm delighted to see so many people here, not only those that have contributed in this collaborative venture, but all those that are interested to know a little bit more. And please ask, because we are delighted to be showing you this great new initiative of joining all the organisations together that are committed to preventing heart disease and managing heart disease in Scotland. We're working together and we want to share this Heart Pack with you all.
The Sign Guideline initiative began in 1993. It was established on the basis of all medical colleges working together in Scotland to determine what was the best evidence for treating a number of conditions. In fact, the two guidelines here represent the 40th and the 41st of a series of guidelines. In this case, two guidelines together looking at primary and secondary prevention of coronary heart disease.
We hope that you have found our programme useful. SHARP aims to increase the awareness of cardiovascular disease and its risk factors, not only amongst healthcare professionals, but also the population at large. Our goal is to reduce the incidence of coronary heart and other vascular diseases in this country, and certainly you and members of your primary healthcare team can play a full and useful part in that process. Thank you and good luck.